in his father. So I'm president of Rotary Club Bareilly.
You saw my Instagram or something?
Yeah.
Come.
I told my father that.
That I'm in Rotary.
Yeah.
Actually,
I'm
I'm
very much interested.
very active in Rotary.
Yeah, I'm a major donor. I'm a assistant governor and all these things.
That's right. Good. So sir, you should be DG next year.
No, I can't take the time now. I'm not able to even be an AG properly. I'm current AG here, but it's very hard to spend time, Yesterday we had our district conference, just got over. A lot of roles in that, and Rotary, if you take a responsibility, you should do it. Very difficult to give time now for me to become governor. Many people want me to, but I can't do now. At least not for the next 5 years.
Maybe it's a president who I'm seeing that I'm so much involved. I've got 2-3 businesses with me.
Okay.
So I have to spare a lot of time.
Yeah, I was a president of our club 12 years ago. I'm in Rotary for 20 years now already.
Please, sir, मैं coach हूँ and
Everybody I know here, I used to be so active in Rotary. Yeah.
मैंने देखी आपके प्रोफाइल से मैं आइडिया लग गया और very active in Rotary.
पहले तो बहुत ही एक्टिव था, अभी इस साल फिलहाल again I'm active, but it requires lot of time. तो blocked nose, right side, deviated, बहुत ही deviated है. Okay. Yes. So most likely we may not need rib for you. Like 90% I may not need, but still you have to give me that consent for harvesting rib just in case. For some of the patients we cannot do without, but for your case most likely I can manage. But still I'm just telling you because you got to give me consent. That's the first thing, and we can get you proper results, no problem. So see, there are few issues I'll tell you. It's very big one.
Yeah.
Then you see this is called dorsal aesthetic line. So it's not straight. It's going towards the left side. Then here it's narrow. Here it's broad. Here the hump is big.
Yeah.
So we have to reduce the hump, increase the width here. If you see, it's very narrow like a omen. So we need to make the nose little wider here. Here the bend only should be removed. Then when you come to the tip, again the tip is bifid. So it's like there's a groove there and
Double chin.
many things are there in your nose. So everything can be put together. We'll have to do osteotomy, all of that. The only good thing is there is excess in your nose and there's not less. So the girl I saw before, I mean her nose, there's like I need to take rib and I need to bring the nose more outside. Augmentative rhinoplasty, yours is not that. Augmentative rhinoplasty is a little bit more difficult than this type of rhinoplasties because we don't need to, just have to readjust things and that can be done much more easily.
Yeah, I want my length to also be decreased.
It will be, yeah, it's too much of over projection and
From this
doesn't
side, I
suit
think
your,
it's very much noticeable.
yes,
But from this
asymmetry.
side,
That is because the nose is tilted towards the left.
side now.
But I'm not only going to make it straight, everything I'll correct the height will go down, tip will become pointy, this will get thicker, this will get thinner. Like the full thing we were going to do, not just one or two things.
So दो तीन चीज़ और थी, जैसे जब जैसे स्माइल करते तो ऐसे ना वो एक नीचे को ड्रॉप करती है ऐसे.
Smile करो. हाँ, that also will change a little bit. Not totally, but it will change a little bit. Because the muscles on the base of the nose are connected to the lips. Paranasal muscles go and connect to the muscles of the lips. So ऐसा नहीं कि वो बिल्कुल मूव ही ना हो. That won't look nice. That will look like a mask. But थोड़ा कम मूवमेंट ऐसा हो जाएगा.
और जैसे एक मेरा ना एक्सरे दिखाऊं आपको.
हमको स्कैन लेना पड़ेगा यहाँ पे. आपको लिया है आई थिंक ऑलरेडी. स्कैनिंग यहाँ पे नहीं हुआ है. तो ये आपको स्कैनिंग यहाँ पे लेना पड़ेगा. इसमें मुझे थोड़ा डिटेल्स मालूम पड़ेगा. फिलहाल ये है तो मैं देख लूँगा बट
लेकिन वहाँ कोरोना काल हो नहीं पाई. इस बीच में इसने आपके बारे में सर्च किया. तो फिर ये इसका मैं सबसे
वो
कराऊंगा।
एक्चुअली थोड़ा पहले ही था, लेकिन काफ़ी फार अवे है हमारे यहाँ से।
बहुत दूर है
जिस
यार।
दिन इसकी सर्जरी प्लान थी उसी दिन से दिल्ली में कोरोना के कारण हॉस्पिटल में एडमिशन
It was scheduled for your only, you know, that
तो उस समय ये कराया था क्या?
हाँ, तो शायद अंदर भी थोड़ा प्रॉब्लम है, इनकी सेप्टम में भी प्रॉब्लम है। बाहर से दिख नहीं रहा, स्कैन में दिख रहा है मुझे, और डिटेल्स दिखेगा जब आप यहाँ पे स्कैन लेंगे। और आपको सर्जरीज कब करानी है? आपको सर्जरी के लिए नहीं सर, आज तो नहीं हो पाएगा फिलहाल।
सो मेरा परसों का फ्लाइट हो गया मेरा।
आप चले जाइए, इनको छोड़ के हम देख लेंगे इनको।
मेरी जान अटकी हुई है इसमें।
नहीं वो तो समझ रहे हैं तो, लेकिन हम कुछ नहीं होगा आपका इसको।
आज तक किसी भी प्लान
आज कल करेंगे,
डेट कर दीजिए।
आज तो नहीं हो पाएगा, कल हो जाएगा, कल करेंगे अच्छी तरह से। आज आप खाना खाए क्या?
नहीं
कुछ नहीं खाया, 6:30 बजे
मैम
उठा
से
है।
बात हुई थी तो मैम
आज एक बेबी भी आए हुए हैं बीच में, कल करते हैं आपको जल्दी से, कल फर्स्ट करेंगे इनका। हाँ मालूम है, तो कल करते हैं इनको फर्स्ट। इनका पूरा रिजो से बात कराओ, CBC, HIV, HPC सब कुछ
तो
ब्लड
ये टेस्ट हो गया, आपसे मेरी बात हुई थी वीडियो कॉल पे, आपने कहा था अपने यहाँ से करवा लो।
आपने करा लिया तो दे दो इनको,
वो SRL मेरी लैब
नो प्रॉब्लम, आप इनको दे दीजिए बस, हमें तो बस रिपोर्ट चाहिए। जस्ट गिव इट हियर। अच्छा ये सब क्यों कराया आपने? ये तो चाहिए था हमें, नहीं चाहिए था ये सब।
पहले सच हुआ था ना, उनमें था तो आपने कहा कि वही रिपीट कर, तो मैंने सभी करवा दिया इसलिए।
एक्चुअली मैं जो आपने बताया था जो पहले कराया था दिल्ली के डॉक्टर ने रिकमेंड किया था वही आपने रिपीट कराया था। सर्जरी आपसे होनी थी इसलिए वहाँ कोरोना का फेस आ गया दिल्ली में, जबकि शॉर्ट पीरियड में खत्म भी हो गया वो विद इन अ मंथ्स टाइम।
फिर एक डाउट भी आ गया कि अच्छा वो हो गया शिफ्ट।
सब कुछ नॉर्मल है, इसको इसे चाट लो इसे।
सर इसकी 20 की फ्लाइट है शाम की।
आज डेट क्या है?
आज 11 है।
11 है।
कल होगा 12, थोड़ा टाइट रहेगा, थोड़ा पोस्टपोन कर लीजिए इनका फ्लाइट, मैं आपको कल बताता हूँ।
Hello everyone, we have this young interactive patient of ours who has come from very far. A, that is from the north of the country, and B, he's been waiting since long, not only for today, just for this day. He's been waiting for surgery over the past few days. Given the appointment and the schedule of OT, he's just in the pre-op arena about to be shifted inside the theatre. Now as we can see, his chief complaint is with respect to the nose. He is desirous of a rhinoplasty, a nose job for cosmetic but for functional reasons as well. So it's for functional and cosmetic improvement that he desires. We see his nose is not straight, which is the most striking feature. It looks as if the nose is deviated to the left. The reason being the tip has a bend towards the left, and on the scans it's clearly visible as to he has a deviated nasal septum which is reflecting externally this way. If he moves to the side, we see the dorsal hump, we see the nose is not straight, it has a hump which needs to be reduced. The basal view, if you can look up, we see that the tip is here and it's bifid. We can see how the lower lateral cartilage is almost demarcating the tip into two halves, and hence the impression of it going to the left side. Also, as I mentioned, he has DNS, which is deviated nasal septum. The entire breathing issue is because of the septum hitting on, and in his case it's the left side which is blocked. He says he's a habitual mouth breather because the left side is almost blocked. In his own words, the right side is still patent. He's desirous of a rhinoplasty for improvement in terms of breathing and also improvement aesthetically. Anything which you would like to add to all that I said?
No, it was all correct. I am hoping to get it.
Any specific changes that you want from your side, additional?
My main change that I want, that it should not look big.
Right.
Yeah.
Okay.
Curve would be
Yeah.
done.
And you have been told about the possibility of rib harvest, right, by doctor?
Yeah. He told that if it might not be needed, but
Right,
there
if
is
at
a
all.
10% chance.
If at all. If at all. Okay, so we'll see how it goes. He's patiently waiting for his surgery, and we are patiently waiting for the results to come out. Thank you.
கொடுத்துரு இதை மாற்றி விட்டு 2 லிட்டர் கொடு
So we're about to start rhinoplasty. This is a cosmetic rhinoplasty, but you can see the nose is deviated. It's bent towards the patient's left side. Also, you can see that the dorsal aesthetic lines are not complete. We have issues with the tip. The nose has got over projection. A little bit of a dorsal hump too. So we're going to be correcting all of this now. The tip as well. So there's minimal DNS too. We made a nasal septum, so we will be working on the septum as well.
I want to ask, you have reduced my length also?
Of the nose? Yes.
Okay.
We made a proportional see because your nose was like very much big.
Yeah, according to my face.
Yeah, it will look nice.
You are proportionate.
You're very proportionate and your face is angular, you know. So your tip also will be a little pointed only. So it looks good. And there was a lot of work inside in your septum also that I've done. Don't worry, it'll be fine. It's just few hours now after surgery.
So when I'm sitting, my blood is
Through the nose, that's okay. All of that will settle down in a day or two. Okay, fine. Not much pain. And you're able to eat normal diet, everything.
Yeah,
And you're leaving tomorrow or today?
tomorrow. So today evening I will be leaving to Toronto.
Okay, today's how many days up?
7th day.
Exactly 7 days up today?
Yeah.
You can look down, please. Look down, please. Okay. There you go. And you can see the side view. Look at that.
Straight, it is not straight.
Yeah.
So one thing I want to ask, the length has been decreased very much or just little bit?
Length is kept the same. You can see only the hump has been removed.
Okay.
You see the hump here?
Yeah.
It's gone. But the length is the same. But it's a nice straight line now.
Okay. Do you think it's good for my face?
Yes, because you see here,
Yeah.
look now. This is your upper third. This is your middle third. This is your lower third.
Okay.
You have a large face.
Yeah, that's why. I want that
Yeah.
big nose only, but your experience, that's why I'm scared.
Yeah.
Is it looking good? It's not looking.
It's looking nice because we shouldn't make it very small.
Yeah, it is got straight. Yeah.
And you can look up also. You can see up view also.
Right.
See the tip and the angulation,
Yeah.
the relation between the columella, the tip, the straight, everything. It looks nice. And also when you look from the front, it will not look like it's too big. Because earlier, if you notice, there was a huge projection here.
Yeah. That made it look like.
It made it look like a lot. And now, there is still 20% swelling.
Right. Yeah.
This is all swelling. You see when I put my hand,
Numbness over
just
there.
see,
Yeah. It's,
goes in.
yeah. Correct.
So all the skin will drape nicely and it will get really nice. Give it like a few months, it's going to be superb. And you see, I haven't done anything here for you.
Oh, yeah.
I haven't reduced the width of the nose, nothing. Was not needed. I've done the
Only the tip.
tip, osteotomy. This is from the osteotomy, the suture. And we give you a nice straight nose. And one more thing, if you look carefully, hold it. This nasolabial grooves are also less.
Yeah, the lines.
Lines are lesser. Now it's missing almost. It will come back.
Okay.
It won't be as evident as it was before we started.
Yeah, good. Nice.
It'll be nice. So you take care. We'll remove the sutures off. You leaving today night?
Yeah, today night.
Cool. Take good care. It'll take 4 more weeks for the
Really?
nose to heal.
Okay.
Yeah, swelling will go away in about 1 week or so. But till such a time, you have to take care of your nose. Don't wear specs. When you wear mouthwash, wear the tie type, not the elastic one. That applies a lot of pressure there. Send us pictures after a few weeks and take the medications that we give when you leave. You can have normal diet
Okay.
and exercise after 4 to 6 weeks.
Okay, can I brush my teeth?
You should.
No, oh no. The upper lip.
Everywhere you can brush.
There's no issue in moving the upper lip.
No issue doing anything in the
Can
mouth.
speak.
Yes.
Okay.
Anything inside the mouth you can do. You've done nothing inside your mouth.
Okay.
So you're fine.
When I move my upper lips, it looks like it will affect this. So that's why I take precaution.
This is because the muscles attach here and also come and attach there.
Yeah, they are the same.
Just
that's
feel, but don't worry about it. You can do normal activity. That's why we say that you can eat normal food. Matlab there is no risk for you. There's no problem.
No issue in bending down or holding the luggage a
So,
little bit.
so you should not exert much.
Okay.
If you exert a lot, you can have some nasal bleeds.
Okay.
So you must exert less.
Okay, and there is no issue in sitting for long hours, like if I'm
Yeah, sure.
3 to 4 hours.
More than that, you can sit continuously.
Okay.
No problems with that
Fine.
whatsoever.
Okay. Thank you, sir.
You're welcome. Take care.
Very much happy with the results.
Take care. It'll get even better.